Well, hello and welcome to day one of your Clutter to Clear workshop. So my goal is to make this quick and painless. I want to present you with some awesome information, basically to make your life just a little bit easier. The more we know about our bodies, the more we know about this midlife transition, the more we know how menopause and our fluctuating hormones affect us basically from the top of our head to the tops to the bottoms of our feet. It affects your entire body. And so I tell my clients all the time, obviously, the more you know, the better you can do. So all I want you to do is sit back, jot down anything that you feel pertains to you, any questions that you have. I know this isn't live, and so I definitely encourage you to email me your questions, or if you want, set up a chat and let's get together and let's go through it and talk specifically about your situation. And that way I can help with what's really, what your struggles are versus trying to have a big group chat. And I love that, to be able to really hone in on your specific situation. So I'm going to go ahead and share my screen now. This is super casual. Again, I'm just going to present you some information between now and the next 2 days, and take some notes, figure out what you're starting to notice that you're like, wow, that totally resonates with me. You might notice that this isn't anything you're struggling with personally, but maybe your best friend is, or a family member. You can share this information with them. But the good thing is you also have the information because maybe it's not affecting you now, and maybe it doesn't affect you for 6 months or even 6 years. But the more you know, the better you can do. So let's jump into it. I don't want to waste any of your time. Here we go. There we go. All right, y'all. I'm going to my picture over here, and I'm going to jump right into this so that we can get going. There we go. All right. So a little introduction. What does brain fog look like? I get this question a lot, and like what are some of the symptoms I should be looking for with brain fog? And it could be anything from fatigue, slow thinking. Maybe you're just struggling to organize your thoughts, or somebody that used to be, really strong at multitasking. Maybe all of a sudden they're noticing that they just can't do that anymore. They really have to focus on one project at a time. Forgetfulness, lack of focus or concentration, even unable to process a simple thought or formulate a sentence, which obviously I'm struggling with right now. That's probably one of the biggest issues I know for myself. I struggle with just trying to find words, and my husband's like, what is it you're trying to say? You might feel maybe spacey or disconnected. Maybe you lose your train of thought mid-sentence. I think a lot of us struggle with that. You forget what you're doing. You forget what you're getting ready to do. Like when you walk into a room, I think we've all been there. Maybe you're having to have people repeat themselves so that you can comprehend the information. Maybe this is something that you hadn't struggled with in the past that you're now noticing is a new feeling to you. Processing new information, or just being able to make a decision. I've heard from several women that they're like, you know what, I was not indecisive before, and now it's like I just can't wrap my mind around certain things, and that's what they're struggling with. So it's important to understand that, yes, brain fog can happen to anybody. It can happen to, males, females, any age. There's so many different factors that go into why you might be struggling with brain fog. And it could be, just directly related to how much sleep you're getting. Think about college students that are kind of like, oh my gosh, trying to cram for those exams. So it's not necessarily just menopausal women, but there is that connection that we want to talk about. So brain fog can also, besides lack of sleep or lack of quality sleep, can be brought on by like stress, dietary issues. So poor gut health will definitely affect how your brain is functioning, or even food sensitivities. So today, what I want to talk about is focusing on just the connection between brain fog and that hormonal shift, because it's very important to understand that as we go through perimenopause, menopause, postmenopause, we're going to see these signs and symptoms maybe a little bit more often than we had in the past. One contributor is that our sleep disturbances obviously kind of increase in perimenopause. So maybe you're struggling to get to sleep, or maybe you're struggling with getting quality sleep, staying asleep. Another issue I know with women, besides hot flashes or night sweats that affect their quality of sleep, is urinary incontinence. So maybe you're having to get up a lot to use the restroom, and then when you go back to bed, you're really struggling to get back to sleep. That's very common. Changes in our estrogen are also going to affect our brain. So basically, our estrogen contributes to our language skills, our attention, our mood, our memory, brain processes, basically, is what we're talking about. As the drop in estrogen happens, there's also that link to anxiety and depression. Both of them are very common in midlife. And it doesn't have to be anything extreme. You might just notice a little bit of sadness, or maybe you're feeling a little bit more blue. And that's common around our cycle at all ages. You might notice it be happening more often throughout the month, where maybe it was just 1 or 2 days when you were in your 20s or 30s or even early 40s. Research shows that 60% of middle-aged women report difficulty concentrating and have other issues with cognitive health. So these numbers definitely spike as women start to go through perimenopause. Basically, your sex hormones, like I said, specifically that estrogen or estradiol, affect your central nervous system, and that helps us fire on all cylinders. So when we don't have all of that working with us, there's basically your hormones are like little messengers, and sometimes those messages get lost because we're just not firing on all cylinders anymore. So with regard to treatment, if you were to go into your doctor and say, hey, I'm struggling with brain fog, what are some treatment options? Most doctors will tell you that if it's mild, it'll go away on its own as you make your progression through perimenopause into postmenopause. Now, that being said, you can be in perimenopause from 5 to 13 years. So we don't want to struggle with it that long. Some of the treatment options, I always tell people to look first at those basics. Let's look at your sleep. Let's look at your stress, and let's look at your nutrition. And we're going to get more into how nutrition is tied into brain fog, brain health, and all of that later on in the workshops. But one of the things that I always talk about is why you just cannot ignore brain fog, and why we still need to make sure that we're paying attention and not just blowing it off and saying, okay, well, it's going to get better. If you're noticing it's mild, it's not a big deal. But if you're noticing that it's starting to happen more often, it's lasting longer, or there's additional issues. So maybe it was before you were just maybe forgetting where you set your keys, and now there's several symptoms that you're like, no, I can't remember this, or I can't multitask, or I'm struggling with this. If you're starting to notice that, it is important to have that conversation with your doctor again, and let them know that you do have that concern about Alzheimer's, because 2 out of every 3 Alzheimer's patients are women. And as they do more research on women's health, they're starting to see the connection between midlife women, perimenopause, menopause, postmenopause, and how that really does pose a threat to our cognitive health. So that a lot of people don't, or haven't in the past, put the two together. They haven't connected menopause and Alzheimer's before, and they're just now starting to see that relationship. And so that's why it's super important that we're opening up that dialogue, and that we're aware that is a possibility, and make sure that we're asking the questions. 80% of women going through menopause will experience some kind of neurological symptoms, such as insomnia, depression, anxiety, memory loss. That doesn't necessarily mean that you're going to have Alzheimer's, but it is something that we want to be aware of. Estrogen and estradiol protect our brain. It is a neuroprotector. Obviously, when that decreases, we don't have the protection that we had before. Alzheimer's begins in the brain decades before that first symptom. So you might have issues back, in your 40s and 50s, not necessarily. We're no longer looking at somebody in their 70s, 80s, and 90s. So symptoms of a potentially higher risk of future Alzheimer's are often dismissed as brain fog. But again, we want to make sure that we're aware that it is a possibility. Alzheimer's disease is the most common cause of dementia. And so that's why it's so important that we're talking about this. What research has found recently is that women in midlife had 30% more Alzheimer's related plaque than men at the same age. And basically, this is that buildup on the brain. That is directly related to that drop of estradiol. Remember, that brain protector. So we're noticing 30% more in women than in men. Women also had 22% lower energy levels in the brain. So 22% lower than men. And then about 11% more brain shrinkage than men. Again, all of this associated with menopause. That is why this is so important. It's important to understand that it's out there. It's important to understand that they're doing more research, and it's important to talk to your doctor about it. If you feel like the doctor is just blowing you off, if you feel like it's more extreme than just a little casual brain fog here and there, I would get a second, third, fourth opinion. Don't get blown off. Don't allow people to just push that issues under the rug and excuse you. And so we want to make sure that we're being very proactive, and we want to make sure that we are being that voice for our health. And even if we can't be the voice for our health, maybe we need to be a voice for our family members' health. So just keep that in mind. Obviously, there's different types of risks, risk factors for dementia. That includes, your medical, your lifestyle, and your environmental factors. So all of that is super important. One of the things that we can control, we can't always control our environment, we can't always control our medical, but we can definitely control our lifestyle as much as possible. So my tip today for closing out day one and really focusing on the menopause connection and treatment options and understanding what brain fog is and getting that connection with Alzheimer's disease is really do a little lifestyle inventory and start with two of those big factors, being how is your sleep and how is your stress management. If you were to prioritize those two things, would you see a decrease in brain fog? That's where I always help people to start. And then the third one, obviously, working with nutrition, which we're going to get into later on in the workshop. But hopefully that gives you some information to get started with. I'm going to stop sharing my screen here. And we're back here. So lots of information in a short amount of time. I encourage you to kind of just digest it first. And again, a little self-inventory. Where do you feel you are fitting in with all this? What symptoms are you starting to notice? What conversations do you need to have? And again, if you want, I'm here. We can chat. Otherwise, I will see you tomorrow for day 2.